Thanks a lot, Chris. I'm Elizabeth Haddix. I'm a support attorney to the International Worker Justice Campaign with UE, and I've worked with UE 150 since it was the Housekeepers Union. The work that I've done is, in the past 6 to 7 months, has been to collect data, to collect records from the different state agencies to essentially show what we know. That the losing end on this are the patients and the workers. We want to show, and we have shown through the data that we've collected, that in fact there is no due process for state employees to bring the issues that affect them on a day-to-day basis. The way to resolve these workplace issues and make a better, more efficient place to work, a safer, healthier place to work, is to have a contract, to have a collective bargaining agreement. I'm going to talk about just 2 things because Chris has laid the groundwork for what the reform did. Secretary Benton has done a great job, as far as I'm concerned, in providing us with information. We did 2 public records requests and got very prompt responses to those with Secretary Benton. One of those was to request all of the OSHA 200 logs, which show all of the injuries that are reported. To be reported, they have to be serious enough to actually cause some lost time or some serious enough injury to warrant report at just the 4 psychiatric hospitals. I'm going to read you just one day, okay? 3 different injuries on one day, and those were not all the injuries on one day, from Cherry Hospital in 2007. On 6/05/07, an employee was injured while assisting in placing aggressive patient in NCI holds, which we'll hear about from our witnesses in a moment. The patient dropped, causing weight to pull on an employee's back, causing back sprain. Another employee was attempting to stop a patient from throwing furniture and was pushed into bed, causing rib fracture and injury to knees and back. Another patient on the same day was assisting with getting a patient to the shower and was pushed into a wall, causing back, shoulder, and sprain. On the same day, another patient kicked the employee in the chest, causing her to fall against the wall, soft tissue injury to back and bruise to chest. Another patient on the same day, patient was kicking and hitting its staff, and employee sprained her left shoulder and neck. There's a stack literally this high of these OSHA 200 logs that Secretary Benton provided to me, covering 2003 to 2007. It shows, and I just looked for purposes of tonight's program at the 2007 numbers. From the 4 psychiatric hospitals, we lost a total of over 4,000 work days from worker injuries. Almost 90% from the records that I could from the information I could discern from the records, almost 90%, and that's a conservative estimate, were involved a patient. I don't say were caused by attacks by patients because the information is not that specific, but they involved a patient. These are patients we're going to hear about from a moment from the various witnesses that are going to testify who are cared for day in and day out by healthcare technicians, by certified nurse assistants, by nurses. Those are the frontline workers, and we're hearing from about 8 of them tonight.
4,000 lost days over a year.
1 year. When a patient, in the last testimony that we hear tonight, I'm sorry. And I'm sorry, I've just been instructed we have to hold questions until the end, and they'll be for the panelists.
Ken, no question. We're
going to move on. We got a lot to cover tonight. One of the last testimony that we're going to hear by video is from a worker who was stabbed at Broughton Hospital. He couldn't be with us physically, but he's going to talk on video. And I want to talk a little bit about how that worker who was stabbed by a patient was treated after he was stabbed. And this addresses the second point for tonight that I'm going to make. And that is that the forum for employees to address workplace concerns when you get a write-up, when you get suspended, when you're being investigated by a patient advocate or by the facility itself, is the grievance procedure. Now, the grievance procedure, I've met with workers for 10 years now talking about using the state's grievance procedure, is something that the workers at these facilities have no confidence in. And the numbers that I received from Secretary Benton's office actually bear out why there is no confidence in this procedure. At Broughton Hospital in 2007, there were a total of 12 grievances filed. 2 of those grievances were found in favor of the employee. 2 of those grievances were dismissed, and I can tell you why. They were dismissed because the agency said, you don't have a right to grieve this. 6 were found in favor of the department, and 2 were resolved by settlement agreements. At Cherry Hospital in 2007, we had a total of 28 grievances. We had 10 found in favor of the department, 4 found in favor of the employee, 9 were dismissed, and 5 resolved in grievance in settlement agreements. I won't go through the other 2 hospitals because we're short on time, but the point here is that the only way to talk for you to talk with management about the issues that concern you, getting written up for not coming in after working forced overtime, a double shift, getting written up for closing your eyes while on the shift because you worked 2 shifts back to back. That procedure, let alone, getting a starting salary at $17,000 to work as a healthcare technician, working there 11 years, as one of our witnesses did, and not even reaching your midpoint at the end of that 11 years, so that you're making $25,000 a year at the end of the year, at the end of those 11 years. This is the only procedure you have. I'm going to finish now by reading to you what happened to Eric Davis. Remember his name. You'll hear from him at the end of this proceeding. He's the last witness on video. He, after his stabbing by a patient he was trying to restrain, he received a written warning dated January 10th, 2008 from Helen Haynes and Betty Giles at Broughton Hospital. This written warning says, this letter serves as notice of a written warning for unacceptable personal conduct, for willful violation of known written work policies, abuse, neglect, or exploitation of patients, prohibition of, and clinical policy manual 3/19. Specifically, on 11/05/07 on Ward 15, you were assigned to monitor patient 1-to-1. This patient was able to obtain a pair of scissors and subsequently stab you. CPM 319 requires assigned 1-to-1 staff to keep the patient under continuous visual observation. Your failure to keep the patient under continuous visual observation created an unsafe environment for all the patients and staff and could have resulted in death or further serious injury to others. As a result of our investigation, both advocacy and administration concluded that your actions constituted neglect of this patient. As you'll hear from Mr. Davis, he, like most of the other healthcare technicians, got his attention drawn away for a moment by another patient that needed his attention. Understaffing is a serious problem. Unjust grievance procedures are a serious problem. Collective bargaining is a way to resolve these serious problems. Thank you for your advocacy and your activism tonight.